This project was about trying to do laparoscopic surgery in rural parts of northeastern India. If you want to operate on someone's abdomen, you can either do it open, where we do a big cut, where we can see all the organs and get in, manipulate the tissues with our hands themselves, or we can do it laparoscopically or through Keyhole, where we insert small ports and small instruments to manipulate the tissues and do the operation. The advantage of this is that after the patient wakes up, they're often in less pain, they take less time to recover, and they have smaller scars. So the short-term outcomes are much better. One of the problems with doing laparoscopic surgery is that you need to create some space in the abdomen so that you've got some headroom to manipulate the tissues. To do this, we pump in carbon dioxide, and this blows up the front of the tummy wall and gives us some space. This also requires a general anaesthetic so that the patient is asleep and we can control their breathing and help them breathe against this added pressure in the tummy. In that sort of setting, a general anaesthetic and piped medical grade carbon dioxide is just not available. So the device that we were evaluating in this study was to see if we can try and do laparoscopic surgery without the need to pump up the abdomen with carbon dioxide and therefore without the need of a general anaesthetic. Fundamentally, this device lifts up the anterior abdominal wall, the front part of the tummy, to create the space and allows you to put your instruments in and do the operation without the need for gas. And because we're not putting gas and pressure in the abdomen, we can do the whole operation under a spinal anaesthetic, which allows the patient to be pain-free and comfortable without the need for a full general anaesthetic.
Currently, the surgical services that are functioning in these hospitals are behind by 20-30 years now. So introducing a gasless model is going to be very beneficial to save lives. At the same time, we are going to minimize the amount of trauma that is going to happen during the surgery, reduce the amount of scarring, and help these people to get back to their work and sustain their families. We've realized that about 2.4 million surgical procedures are required in the northeastern part of India, which we are focusing. About 300,000 of these procedures would be amenable for laparoscopic intervention. So our application would be focusing on the rural surgeons of India, where we will need to train them. So our plan is now to focus on about 5 or 6 rural surgeons, get them into a training center, teach them laparoscopic skills, tell them all the pros and cons of using a gasless lift laparoscopic instrument and how they're going to improve their surgical practice in the near future.
So the broad project of the Global Health Research Group is to really look at improvements to gasless laparoscopy and to look at how we can do that. And there's some really kind of big areas, so you can see from this equipment it's quite bulky, it's very heavy, it's difficult to transport, particularly to rural areas. But there are also some quite focused areas where we felt that there could be some nice improvements made. And one area was, in particular, the lift applied by the device to the abdominal wall here. The surgeon using the device needs to ensure that the device lifts this abdominal wall enough to get a good field of view so that they can see inside the abdominal cavity effectively. But equally, you don't want to lift it too much and apply too much load and cause trauma to the patient, so bruising to the abdominal wall, for instance. So we felt there was a really nice project to work on a load meter device which could monitor and feedback the load applied to the patient's abdominal wall so that the surgeon using the device could actually change their practice according to an appropriate level of force applied to this area. So the students we assembled worked over the summer. We had medical students working together with engineers and then working with a multi-disciplinary group of supervisors as well to work out what the challenges were and the requirements for this project, and then to actually make a physical prototype which we then went on to take to cadaveric testing to evaluate. We're really grateful to receive the funding from Translate because it allowed us to assemble a multidisciplinary team of not just students but the supervisory team and get everybody working and discussing and addressing a really important topic, which has led to short-term gains in a particular piece of apparatus, but longer term, developing future links and future research projects. It's worth emphasising that improvements in equipment like this for global surgery and global health also bring benefits back to healthcare systems like the NHS. Improvements in frugal engineering can really help benefit when resources are scarce or constrained. Working together in a multidisciplinary context isn't always trivial, but is really important in this kind of area.